What's going on, everybody? My name is Eli, and welcome. Make sure you subscribe to the channel. Only somewhere between 10 and 15% of people that watch my videos are subscribed, and I'm trying to get that number up. It's not so much about the subscribers, but the more subscribers I have and the more people that watch my videos, the more likely I am to pop up in the search bar and the suggested panel, which is how the people that don't know me who are pre-dents looking for advice will be able to find the videos. Anything that's going to increase a pre-dent's chance of following my channel or finding my videos, I'm all for it. So make sure you subscribe. It really helps a lot and I really appreciate it. Another note before we jump into the video, make sure you watch until the end. I will be announcing my channel's very first giveaway. So in today's video, I'm going to talk about why I chose to pursue dentistry and why I switched from pre-med to pre-dent. As you all know, this channel serves the purpose of passing advice for pre-dental students on how to apply and get accepted to dental school, as well as to follow me throughout my journey through dental school and eventually, who knows, maybe while I'm a full-time practicing dentist as well. So as part of having this channel, I feel like it's necessary to give you guys a little more personal information about me and my journey, and that will help you guys relate a little more, as well as know a little bit about myself. I don't want all the videos to just be, my tips on applying or taking a DAT. While I'll have many videos that are like that, I will also have videos that are just about me and my dental journey. Also coming up on the channel, I will start my Days Before Dental School series, where I'll do a little bit of vlogging, following things I do in my daily life as I'm getting prepared to move to Boston and start dental school as a first-year dental student at Boston University. So we're going to dive into a deep story time. So I'm going to start by talking about why I was pre-med. Growing up, I was pretty good at science and math classes, especially in high school. And I knew I wanted to go to college, but I wasn't necessarily sure what I wanted to major in. Since I was a pretty good science and math student, my mom suggested that I go for a major in biology. I kind of knew that the profession that I wanted when I was older, I wanted to help people and I wanted to work with my hands. So automatically the first thing that popped into my mind was to be a doctor. And of course, majoring in biology is a very helpful step in getting me to that career goal. So I grew up playing sports. As a younger kid, I was playing football and basketball. By the time I got to high school, I had recently broken my wrist playing football, so I stuck to just basketball. And then I also played a little bit of lacrosse in high school. As someone who wanted to pursue medicine, I found that being an orthopedic surgeon would be my way to not only practice medicine as a career, but also stay around sports. So I ended up kind of dreaming this lifetime goal of being an NFL team doctor, and that was kind of my way of telling myself to stick to medicine and putting some kind of tangible goal as an endpoint to help myself work towards my goal. On top of these goals that I had, when I got to college as a biology major, I felt like pre-med was a career path that was basically pushed on students that were in my major. Not saying that that's a bad thing, but I do think that if you wanted to explore other professional school options in the science field, such as dentistry, pharmacy school, veterinary school, you were left to do a lot of independent research on those career paths, whereas pursuing medical school was something that had an abundant amount of resources that were available to you, and you never really had to go seek more information out. It was basically what I would say is the easy route. As I started to progress throughout my years in college, I noticed that not only was orthopedic surgery one of the most competitive specialties to get into in medical school, Being an NFL team doctor is probably one of the most competitive jobs to get as an orthopedic surgeon. So I was already shooting for the stars, and I'm not saying that's bad, but understanding my academic record in undergrad and what I would have to do in medical school in order to achieve these goals, I wouldn't say it's unattainable, but I had to be very realistic with myself in what would I do if I did not achieve that goal, and would I be happy practicing as a different kind of doctor? And I wasn't really sure, so I decided to look into other options. So moving on from that, I'll discuss what got me into dentistry. So after I graduated from undergrad, I had just turned 22 years old. I started working at the NIH in a post-bac research program that they had. The reason I decided to do that was because I felt that developing my research skills would kind of give me a leg up in the medical school application process. Now, not only did this afford me the opportunity to develop research skills, but it was also a full-time job. So I finally started making a little bit of real money to put in my pocket, and I decided that I wanted to go back to my orthodontist and get braces for a second time. Now, when I was growing up, I had a pretty sizable gap in between my two front teeth. I had braces. I got them when I was, I think, 12, and I got them off when I was 14. And the first time I had braces, I felt like my retainer didn't really work. So I went back to my orthodontist, because when you get your braces off, you have to get periodic retainer checks. And I told him about the issue. And that was when my orthodontist informed me that I needed a frenectomy, which was basically I had to get a piece of my gums clipped between my two front teeth. And as most people would be, I was pretty upset that he let me pay all this money for braces and go through 2 years of treatment without mentioning that. So when I decided to go get braces again after college, I called the same office, but someone new had taken over as the practicing orthodontist of that office. And she was a black woman who graduated from Howard University, and that orthodontist was the first black healthcare provider I had in my entire life. So after visiting her office and getting braces again for this time 1 year, I not only was exposed to a black healthcare provider, but I also developed an interest. So around the time that I was getting my braces off, I was also studying for the MCAT and planning to apply to post-bac programs. So I only applied to 2 post-bac programs. One was the Drexel Pathways to Medical School. I think that's the full name. It's called DPMS, and it's at Drexel. It's a 1-year master's, and if you perform well in the program, you are admitted to Drexel's first-year medical school class the following year. The other program I applied, which is the one I ended up going with, was George Squared, which is a post-bac program between Georgetown University and George Mason Universities, with the option to finish your master's in physiology through Georgetown the summer after completing the 9-month program. So now I'm going to talk about why I decided to actually make the switch from Pre-Med to Pre-Dent. So after applying to those 2 programs, I had this lingering interest in dentistry that I just couldn't get out of my head. I talked to a few people about it and what they thought I should do, and I felt like I was just kind of scared to jump ship, not only because I felt like for so long I had been working towards this goal for medical school, but I also didn't want people to think that I was trying to take the easy way out, or that I thought dental school would be easier, or that was a real internal conflict that I had to face. And I ended up changing, and I don't regret it for anything. And I just hope that anyone watching this video that has the idea in their mind of changing, or at least exploring the other options, that you truthfully just explore and see what you like, and never feel like you have to pursue something because of what other people may think. But anyway, let's get back to what I was talking about. So I applied for those 2 programs, and I told myself if I didn't get into the Drexel program, which means I didn't really have any tie to specifically going to medical school, I would really explore my interest in dentistry and heavily consider making the switch. I got waitlisted at the program at Drexel's. I decided to go with George Squared because the deposit was due. And the first thing I did was ask my cousin if I could come down to Atlanta and shadow her for a week. Now, yes, very important. My cousin is a dentist in Georgia, but I hadn't seen my cousin in probably 8 years or so, and you know, she did previously try to put the idea of dentistry in my head, but like I said, I was not only scared to make the switch, but I didn't really have much interest after I graduated college. So I asked her if I can come shadow. She said yes. And I also asked a friend of mine who was attending Howard University if I could come tour the school with her, and she also said yes. So 2 things that immediately jumped out at me was, one, how many people were willing to help me decide if I wanted to make the switch, and how open they were in welcoming me to the field of dentistry, and 2, how helpful people were in helping me figure out things like shadowing, how to apply, what to look for in the school, etc. So I don't want to get to rapping. I told y'all that in my other videos. I try to keep it concise, but basically I'll say that my visit to Howard was amazing. Seeing the family atmosphere they had up there, how happy people were about being in dental school. I was very turned on to dental school and Howard University at that time. And like I said, my orthodontist was a graduate of Howard University, and also my cousin was. So I went down to shadow my cousin, and a good thing about my shadowing experience was that I got to experience not just what happens in the office, but everything that dentists do outside of the office, running a practice, etc. And I would say that was really the turning point that helped me decide, okay, I think this is what I want to pursue instead of medicine. Now, this video is not to try to influence anyone to switch or say that one field is better than the other, but more so to kind of give my story and maybe help people that are looking to make the switch decide for themselves as well. A few things that I liked about dentistry, or my shadowing experience specifically, was the autonomy that you have when running your own practice, which of course you can do in medicine as well. The freedom you have to work, I think, was a lot more prevalent in dentistry than what I saw when shadowing physicians. And I would say the turnaround time of treatment in dentistry was just so much quicker than at least orthopedic surgery. And I kind of tell this story sometimes about when I was shadowing an orthopedic surgeon. Someone will come into the office one day with knee pain, and it may be a week or 2 before they can get an x-ray or an MRI. It takes another 1 or 2 weeks to schedule surgery, which will probably be a month or a month and a half out from when you schedule it. And then it takes another 6 weeks to even 6 to 12 months for the person to recover. So you really don't see your work actually working for maybe a whole year from when you first meet that patient. Whereas when I was shadowing my cousin, there would be people that come in the office with tooth pain and don't even have an appointment on that day, and they may walk out of that office pain-free. And I thought that was something that was really cool and that I really liked about dentistry. Not only that, but I know you guys, have a chance to see all these doctors and dentists and stuff on Instagram. And one thing I will say about dentistry is that you have a lot of time to do things that you like for yourself outside of being a dentist. I feel like you constantly hear about how much doctors work, burnout, long residency hours, etc., etc. Whereas I feel like being a dentist would afford me opportunities to do other things in my professional career besides being a dentist. There's a lot of things I would like to have a chance to experience in my adult life that I felt I may not really be afforded that opportunity if I pursued medicine. So to finish the video off, I'll talk just a little bit about how I navigated switching from pre-med to pre-dent, and this will be mainly for some people that happen to be pre-med that watch my videos and are kind of thinking about it. So this part will be mainly for you guys. Switching wasn't hard, especially because my post-bac program wasn't necessarily focused on one or the other. It was just focused on getting you into professional school. I even have a friend from my post-bac program that's in pharmacy school now. So switching wasn't hard. I just immediately started studying for the DAT, which also wasn't too hard because I had taken the MCAT maybe 3 or 4 months before I started studying for the DAT. The material was fresh, sure, in my head, but I wouldn't necessarily say it was an advantage because I felt like my brain was wiped out after the MCAT. If you have questions about switching from pre-med to pre-dent, or you have a small interest in dentistry and you're already a pre-med student, if you'd like to talk more about it, you can reach out to me on Instagram or comment under the video and I'll make sure to get back to you. Now let's get to the giveaway. So my first giveaway is going to happen when I reach 250 subscribers on YouTube. I will be giving away a 1-year subscription to the ADEA Dental School Explorer book. For those who don't know, I'll tell you a little more about the book. Essentially, I have notes on my laptop, so bear with me. Essentially, the book is a resource that I used when I was applying to dental school that tells you different stats about each dental school, including average GPA, average science GPA, the demographics of who's applying and who's being accepted, including race, gender, whether they did a post-bac or master's or not, average entering age. It also maps out the required prereqs for each school and a whole bunch of other stuff. It's a great resource for anybody that's applying. And just to keep it fair, I know I have a lot of friends and family that support my videos by watching. So for the people that don't need this resource, you can also enter the giveaway for a $20 Amazon or Visa gift card. So as I said, I used the ADEA Dental School Explorer when I was applying for school, and it's worth about $25, but it immediately paid for itself. There was one school that had been reaching out to me over and over after I took my DAT, telling me to apply, and I basically knew I was going to apply for this school because they had been reaching out to me, so why not? And when I bought the ADEA Dental School Explorer, I found out that psychology was a required prereq for this school, and I had never taken psychology before. So I paid $25 for the Dental School Explorer, but it ended up saving me the $200 it would have cost me to apply to that school. Just to clarify, who knows when I'm going to hit 250 subscribers. The subscription for the ADEA Dental School Explorer is a 1-year subscription, so I will not purchase it until the winner of the giveaway is announced, because I would hate to buy it now and not hit 250 subscribers for another 3 months, and then there's only 9 months left on the subscription. So for those who want the book, I will wait until a winner is announced to purchase the book, or to purchase the Visa or Amazon gift card if you don't want the book. So the rules for entering the giveaway are very simple. 1, you must be subscribed to me on YouTube, Student Dr. Eli. The link is in my Instagram bio, or if you're watching this video right now, you can hit the subscribe button if you're not subscribed. 2, you must be following me on Instagram because I have to have a way to reach out to you. And number 3, repost one of my Instagram posts that have one of my YouTube thumbnails in your story and @, me, so that way I have a way of keeping track of who's entered, and I have everyone's name kind of in one place, and I can throw everybody's @name in a hat, pick one out, and reach out to you on Instagram so you can claim your prize. So that's pretty much it. Follow me on YouTube, follow me on Instagram, and repost one of my thumbnails. And @me. You have to make sure you @me, because if you repost it and don't @me, there's a chance I may not even see it. So that's it. The winner of the giveaway will be announced in a video after I hit 250 subscribers. It's a free $20 or $20 gift card for anybody, or a very good resource for applying to dental school for all the pre-dents that watch my videos. So as always, I appreciate you, whoever you are that's watching this video right now. Every single person that watches the video, I appreciate you for tuning in. Make sure you like, comment, subscribe, and share. That way my channel can grow and reach the people that it really needs to reach. If you watch this video and you are having a newfound interest in dentistry by any chance, you can check out some of the other videos I've posted that I'll add to the end card of this video and make it easy for you to just click on it and go. And check out my other videos on applying to dental school or taking the DAT. As always, Thanks for rocking with me, and I'll catch y'all in the next video.